and I am here again, your student nurse for today. I am Nika Samlasanyu, and I am here today with a very special person who is very near or dear to my heart. This is
student nurse Renmei Limbaga.
Yes.
And what we're gonna do today? We're having this video.
Yes, today, partner, we're going to have a video, health education, and this topic is about HIV. Yes,
Yeah.
partner.
For your ideas, guys, we chose this topic HIV as the requirements to fulfill the requirements from our course to have or to conduct a health
Teaching video.
teaching video. So we have come up to this idea
Yes.
to make it in our YouTube channel.
So that we can also share our knowledge to you guys who are watching. So let's start, partner, with our topic. Can we?
Sure,
Of
I'm
course,
ready.
yes. So first thing is, can you introduce what really HIV is?
What HIV exactly is?
Yes.
As I have known, this is a virus that attacks the cells in our body. If I'm not mistaken, it's the CD4 cells.
Yes,
So
indeed.
it weakens our
Immune system.
Okay.
Yes, and the causative agent of HIV is human immunodeficiency virus. See, partner? And do you know the mode of transmission of this kind of virus?
Well, of transmission, the very common is having sex.
Yes,
Through sex.
Yes, indeed. Having
With an infected
sex
person.
with an
La-
unprotected sex from an infected person.
And also the blood transfusion. You can get HIV from
Blood transfusion, from breast milk from a mother who is infected by this kind of
pre-seminal
virus.
fluid,
Yes.
vaginal fluid.
Yes, sharing of needles or syringes, and another thing is drug injection equipment. So we better use a personal protective care. And the incubation partner, what is the incubation period of HIV?
Mostly that is 8 to 18 months or can be 8 to 24 months.
Yes, several months to 2 years. And can we talk about the signs and symptoms?
Oh, yeah. What are the signs and symptoms?
Yes, the number one thing, the signs and symptoms of HIV is lack of energy, because you know, partner, the HIV weakens our immune system.
Oh, yeah.
So the first symptom is lack of energy, weight loss.
Yeah, losing of weight.
Yes, frequent fevers and sweats,
Yeah,
right?
sweating,
Partner,
unusual
another
sweatings.
thing is persistent skin rashes.
Yeah,
or
having skin rashes,
flaky skin.
flaky skin, and also memory loss.
Memory loss, and also anal sores from herpes and infection. Yes, partner.
Yeah, that are the signs and symptoms if
Of
you are
HIV.
having that symptoms, or if you are having or experiencing, guys, that kind of symptoms. Maybe you have this HIV. Joke. I'm joking. Okay, so
It might be. So you have to consult your physician, consult someone who is professional to
your
this.
healthcare provider.
Yes.
And what are the diagnostic tests
You know,
for
partner,
this virus or disease?
the diagnostic test for this kind of virus is ELISA test. And
What
do
is
you
that
know,
ELISA test? I don't know.
ELISA test is enzyme-linked immunosorbent assay. So it will detect if you really have an HIV. Yes, partner.
And also, what is the specific treatment for this disease?
Yeah.
What if I am infected with it, or I am having this HIV? What should I do, or what
You have
treatment should I undergo to cure this HIV? Is this curable?
no, not really. You have to undergo the HIV antiretroviral therapy.
Antiretroviral.
Yes, this is a combination of daily medication that stop the virus from reproducing.
Yeah, and also this antiretroviral therapy would help that HIV to not progress.
Yes.
And become a AIDS, because if you can if HIV can be cured sooner, later on it will become AIDS.
Indeed. So, partner, how can we be able to prevent HIV? Is there any prevention that we can
Of
share?
course,
to
there's
them?
so many ways to avoid getting infected with HIV. Avoid sexual intercourse from different persons who are having HIV, or else be
Careful.
Yeah, be careful or be protected.
Yes, and partner, can you give an example on how can we be able to be protected by this? If you are having,
If you
having
are
sex,
if you are
how can I protect myself?
use condoms. Advise your partner to use condoms. If
Yes.
you are getting, or if you are into having sex with
Someone,
different person, yeah.
you have to.
And next is to
You have to avoid unnecessary blood transfusion.
Mhm.
So, why, partner?
blood transfusion, since as we have said that the mode of transmission, one of those mode of transmission is through blood transfusion. So we can get, or we can be infected with HIV through blood transfusion. I have heard that one of the nurse of
Uh-huh.
Filipino nurse from
Working abroad?
Yeah, working
Yeah.
abroad. She is working there, and then during the time, like doing her procedures, and then suddenly she pricked her one finger by the needle, and then after a month, she tested with tested positive with HIV, and then
That's so sad.
yeah,
I see. So the other thing that we can prevent HIV is
because
all
it can
preg-
be transmitted blood.
yes,
Blood.
yes. So the next thing that we can be able to prevent ourselves is all pregnant women should be tested for HIV so that the babies won't suffer in the end, right?
Yeah, and they
partner?
will be aware. They will be aware if
Yes.
that pregnant woman is positive with HIV. So they will
can
be
find a
aware.
solution.
Yeah, what she will do, what advices that she will get from her healthcare provider for her baby, like treatment or anything that will prevent
Yes.
from having this worse HIV.
And the next thing is use standard work precautions. And one example is hand hygiene. This is very important today. And also personal protective gear. Yes.
And of course, if you are watching this video and you are working from a hospital or any field that you are dealing with different person, or dealing with person that are known that having this HIV, you have to practice the proper disposal of the biochemical waste.
Indeed. So that we can be able to prevent getting this kind of HIV. So, partner, it's a sad thing to imagine that some people who are, they are suffering from this kind of disease,
Yeah.
AIDS.
Because this HIV, I don't think so. It's curable. It's really not.
Yes, the antiretroviral therapy, it will just stop the virus from progressing, but it will not cure
HIV.
that. Yes.
Yeah. It will just lessen or stopping from getting worse, but it will not like totally cure. So guys, we have to be aware, like we have to be avoid or be smart in choosing
Our partner.
our partner in working in hospital, our health professionals or any staff that are working there. We have to be always careful in doing the procedures, because through blood transfusion we might get infected.
And also syringes, right?
Yeah.
So prevention is better than cure. So it's better to prevent than to cure the HIV disease. So what more you can say, partner? What advices you can share to them?
I don't know that. I don't think so. I have more. I think we gave everything.
Yes, that we have our knowledge to our viewers. So thank you so much,
Thank you so
everyone,
much
for watching. May you protect yourselves from HIV. Combat HIV.
Stay safe, guys. Stay safe and stay
safe
healthy.
from this
See
kind
you
of
next
virus.
time.
Thank you, everyone. God bless.